Yeah, hi everyone, welcome to my channel once more. This is Dr. One and I'm here to talk about diabetes and your career. It's a very important topic and it seems as if career here is being neglected when it comes to managing diabetes. And that's why I want to make it clear here. So, whenever you go to see your doctor, I always recommend all diabetes patients to see an expert or a specialist in that therapeutic area. I'm not saying that family doctors or GP are incompetent. The whole thing here it is the knowledge that they have. You cannot compare a GP and endocrinologist. So having said that, if you make up your mind to see an endocrinologist, a very important thing here it is communication. I would strongly recommend anyone going to see an endocrinologist to tell him or her what is his or her career. For instance, we have people in Africa that they are working as farmers. So imagine how tedious the job can be, and at times they go to job early in the morning. Worst one are those farmers involved in cocoa drying, as we say in local language. In standard English, we say torrefaction. Torrefaction is that transition or processing of cocoa to make it to become chocolate. So you have to get a cocoa bean, put them in bags for them to undergo fermentation. Then you carry them now to oven. Those oven now, they usually do it in the night. So you can imagine someone on metformin or any other diabetes medication working the whole night. So you expect that person to go to bed in the morning while others are going to work. So you see now that that person working the whole night doesn't respect what we call circadian rhythm, or the biological clock is never being respected. So meaning that the sleep pattern for this person is different. So it will be an error for you to put this person on a particular dose of medication without asking the person's career. Having said that, there's also another situation. Say those who do night shifts. So night shift could be a guard, say a night watch, who works the whole night, or even a medical person like nurses. They cover night shift. So when you work in the night, definitely you don't have quality sleep. And when I talk about quality sleep here, remember there are two types here. We have the REM and the non-REM. REM stands for rapid eye movement, and non-REM stands for non-rapid eye movement. So here is the whole thing. There are even situations where you are in bed, but you have a lot of things running in your mind that you're not able to get adequate sleep. A typical example is you were involved in an argument, a heated debate, say 30 minutes before going to bed. Definitely, I don't see you sleeping. Or take for instance, you took a loan from a bank and the bank wants to get their money back. It's going to be really tough for you to have enough sleep. So your sleep pattern will not be the same as it used to be. And the only device to tell how your sleep pattern is by doing the exams, like so, which you hook it on your brain and it tells you how the pattern is. Normally, is supposed to be smooth peaks. If the peaks are sharp peaks, it means you are lying in bed, but you are not sleeping. And that's why most people tell you, oh my gosh, I just got up this morning and I'm feeling kind of tired, exhausted. Of course, because you were lying in bed and you were not sleeping. So that's a clear fact. And if I do that exam to check your brain, you will see there that there are some sharp peaks, meaning that you were not sleeping. You were in a phase called rapid eye movement. So I want to recommend you, if you are having that situation, please have a good chat with your doctor. Let him or her understand what it is. So in general, the first thing here is chronopharmacology. So chronopharmacology essentially has a lot to do with the rhythm of the human body, say sensitivity, the way your body responds to medication. That's to summarize it. So I will give you two examples here that you always remember when you watch my video. We have two illnesses, and the first one it is thyroid. So thyroid function test, when you go and do it, say the T3 and T4s, your values will tell you if you are okay or you are not. Another one is cholesterol. So if you have to put your patient on any of these medication, you need to have a quality conversation to understand how is their sleep pattern. Because if you don't do that, you tend to waste that medication. You are not treating this patient the way the patient is supposed to be treated. And that's my advice. So essentially, chronopharmacology is the study of rhythm, of the sensitivity of the human body to medication. So take a medication like the statins. Statins are popularly prescribed for patients having high cholesterol. So if the cholesterol are kind of spiking, then you need to ask that patient, how is your sleep pattern? That sleep pattern helps you to guide the patient in choosing the right dose and also when to take that medication. I have a situation where I put my patient on a 12-hour statin to be taken in the morning, meaning that that patient has a good sleep pattern. And when I say good sleep pattern here, I mean physiological sleep pattern, meaning that you have more non-REM than REM. So less rapid eye movement. That's the meaning of non-REM. So non-rapid eye movement. That one has to prevail the other one. Because if it's the contrary, you are not sleeping. You are lying in bed with your eyes closed, but you are not sleeping. So that's what happens also with patients suffering from diabetes. When you are working in the night, say like guards, you stay up the whole night. Nurse working night shift, they stay up the whole night. Medical doctors working the night shift, they stay up the whole night, all kind of fluctuating. That's the way they're sleeping is not normal. So there are chances that it can take you into what we call chronic somoggy phenomenon or roller coaster phenomenon or Down syndrome. So the Down syndrome here usually peaks in from 1 a.m. to about 5 in the morning, whereas somoggy, it is the other way around. So these are the three situations where you find yourself in if you are suffering from diabetes. So your sleep pattern has to be checked. Are you having somoggy effect? Are you having Down phenomenon? Are you having, say, a REM or non-REM? So all those things have to be checked. Then now they decide the ideal dose for you. So that's my advice to everyone suffering from diabetes. Sleep is very important, And the sleep must be quality. That is, it must be physiological sleep. Once more, thank you for watching my video. I'm Dr. WAN. Please click and like it. Share with your family. Thank you and bye-bye. Ciao.